Hi, my name is Stacy Tovar, and today I'm going to be talking to you about diabetes. The reason this topic is important is because according to the American Diabetes Association, if the current trend in America continues, it is estimated that 1 in 3 Americans will have diabetes by the year 2050. Okay, so diabetes is a chronic disease, and it is when you have elevated blood glucose levels for a prolonged period of time. There are 2 types of diabetes. Type 1, which is where your body produces little to no insulin, and type 2, where your body does produce insulin, but it's not used properly. So this is a chart showing which ethnicities are more likely or more at risk to develop diabetes, with the Native Americans being those at risk the highest, followed by non-Hispanic blacks, Hispanics, Asian Americans, and whites. So some of the signs and symptoms for type 1 and type 2 diabetes are very close and even share some symptoms like increased thirst, fatigue, blurred vision, numbness or tingling in the feet, and frequent urination. But where they are different is that type 1 diabetics experience unexpected weight loss and increased hunger, and type 2 diabetics have a delayed healing of infections. So now I'm going to introduce some of the risk factors. You are more at risk for diabetes if it runs in your family. You also, if you don't exercise regularly and you have unhealthy eating habits or are overweight. So there are several ways to diagnose diabetes. Here are 3 of the tests. The first one is the A1C test, which gets an average of your blood glucose levels for the past 2 to 3 months. There is the fasting plasma glucose test, which measures your blood glucose levels after fasting for 8 hours, and the oral glucose tolerance test, which tests how your body processes glucose. And for that one, you don't have to fast, you're doing anything special. For the A1C test, you see the furthest one, if your outcome is above 6.5%, you have diabetes. For the fasting plasma glucose, if your blood glucose level is equal to or above 126 milligrams per deciliter, you have diabetes. For the oral glucose tolerance test, if your blood glucose level is above 200, you have diabetes. So if you don't, okay, so some of the treatments and managements for diabetes. For type 1 diabetics, since their bodies don't produce much insulin, you need insulin injections or an insulin pump to help you treat it. For type 2 diabetes, it's more of a management type thing, so you would have to have a healthy diet, start exercising regularly, losing any excess weight, and it's also managed with medications. Some of the more popular ones you see people using are metformin and glucophage. So if you do not manage your diabetes properly, there are some complications that can arise, like certain eye complications like glaucoma and cataracts, nerve damage, foot complications, kidney disease, and several cardiovascular issues like you're more at risk for stroke and a heart attack. There are a lot of ways to prevent diabetes, or type 2 diabetes, apologize. Type 1 can't necessarily be prevented, just managed. Type 2 can be prevented if you, with regular physical activity, a healthy diet, regular visits to your healthcare provider, and maintaining a healthy weight. So in conclusion, here are various local ways in receiving help to manage your diabetes as well as educate yourselves. If you go to the College Times website and you type in diabetes courses, there will be several links showing you seminars available here in Corpus Christi. There's also the Coastal Bend Health Education Center, which has their diabetes education program, and this program is aimed at people who have diabetes and their family members as well, because you do need support from your family to help you get through this. There's also the Christus Fund Health System that have their diabetic classes, and those classes include management training and insulin therapy. So if you or anyone you know has experienced these symptoms or show these signs, to get tested for diabetes, and if they need help with dealing with it or they don't know where to start, here's a good place to start. And I hope this presentation was helpful to anyone that is going through that. Thank you.